Hello everyone, I'm Dr. Praveen Rao, neonatologist working at Cloudnine Hospital, Hitech City, Hyderabad. Sudden infant death syndrome is called in short as SIDS. The new name for this condition is sudden unexplained death of the infant. The babies who are 2 months to 4 months who dies at home without any apparent cause is called as sudden infant death. Actually, this might happen from 1 month of age to 1 year of age. So this is completely unpredictable. So we can't predict which baby will end up in this unfortunate condition, but there are certain factors that help in prevention of this condition, particularly avoiding smoking during pregnancy and later after the baby's birth. Even the passive smoking also will have the impact. Avoid alcohol during the pregnancy and drugs, and that is associated with decreasing the SIDS. After the baby is born, the breastfeeding should be continued at least for the 6 months. That is associated with the decreased risk of SIDS. Safe sleeping practices is a very important rule for the SIDS prevention. First, always keep the baby with the head up position. That means supine position. The baby should see the ceiling. There is no tummy position during the sleep. Rule number 2, the baby should not share the bed with the parents, should be kept in a separate cradle in the same room. Room sharing is very much useful for the prevention of SIDS, but bed sharing is dangerous. That has to be remembered. And the bed, how do you make, that is also very important. It should have a firm surface without any loose objects on the bed. The things that should not be used are quills, soft pillows, head position makers, and the travel bag, the carrier bag, the soft one, and the baby rocking chairs for the sleep should not be used. Coming to the tummy time is beneficial for the baby, but while the baby is on tummy, parents should observe the baby. That is very important. During sleep, there is no tummy position. And don't keep the baby in the sideline position, and don't swaddle the baby in the sideline position. Don't swaddle the baby in the prone position, that is head down position. That is also associated with the increased risk of SIDS. Coming to the vaccination, regular vaccinations help in decrease infection, and that will decrease sudden unexplained death of the infants. Coming to the babies who are more prone to this infection, certain conditions are at risk of the SIDS, particularly the babies who are born preterm babies, low birth weight babies, and twin babies are at risk of SIDS, but there is no need to panic. This is very negligible. And if there is a family history of SIDS, that increases the risk in the next baby, very minimal, and there is no concern to worry about that. But if there is other concerns in the family, like early cardiac deaths or any unexplained death in the adults at a younger age, then the baby might require a cardiac evaluation. That is the only thing we can do. Then coming to the pacifier use is associated with decrease in the SIDS, but it should not be contaminated, and it has to be introduced only once the baby is taking at the breast well, at least after 1 or 1.5 months of age. So these are the main salient points in a nutshell about the SIDS.